Welcome to this men's wellness webinar on vasectomy presented by the Urology Group. My name is Aaron Bay, and I've been in the Urology Group for 12 years. I'm a board certified urologist, went to medical school at The Ohio State University, and did my urology residency training at Indiana University. I have offices at Eastgate and in Norwood. I specialize in enlarged prostate, percutaneous kidney stone surgery, and robotic surgery for kidney cancer, as well as vasectomy. What is a vasectomy? Well, it's a form of male contraception, and it's done in our office. Rarely it can be done in the OR for complicated cases, but the vast majority of the time it's done in our office. It's a procedure that takes about 20-30 minutes. How does sperm work? Well, sperm is produced in your testicles, and it travels through two vas deferens, which connect the prostate to the urethra. During sex, your sperm is ejaculated from your penis. How a vasectomy disrupts sperm is during a vasectomy, that tube, the vas deferens, is disconnected to prevent the sperm from traveling to your penis. Instead, sperm dies and is absorbed by your body. I often get a question about this, and your body will just break it down and reabsorb it, and most patients don't have any ill effects from this. What a vasectomy does not do are numerous certain things. It does not affect your ability to have sex, doesn't affect your ability to have an erection or an orgasm. It doesn't affect the sex drive. It doesn't change the semen, as only a small, very small portion of your semen contains the sperm. Your body still produces fluids, and semen will look and feel the same as before. Vasectomy does not affect male hormones, does not change your voice or your body hair. It doesn't cause health problems. It doesn't protect from STDs. It doesn't solve sexual or marital problems. So how to prepare for a vasectomy? First of all, your doctor will talk to you about stopping your aspirin or NSAIDs. NSAIDs are things like ibuprofen, Toradol, things like that. You'll want to stop them before the procedure. Tell your doctor if you're taking blood thinners like Plavix or Coumadin. You'll also want to make sure that you're off of those. Shave the scrotum, just the front, the area and the flat front part, at least 24 hours ahead of time, and wash the scrotum with some antibacterial soap. Do wear some tighter fitting cotton briefs. You don't have to wear a jock strap, just something with some support. It's usually okay to drive yourself. If you want your spouse or somebody else to, that's fine. If you do take a Valium, we ask you not to drive yourself, but most of the time patients are able to drive themselves. A little bit about the procedure. When you're in the room, you'll undress from the waist down, lie down on the exam table. Our staff will help cleanse the area with antiseptic soap, and a local anesthetic will numb the area. There is optional sedation. A little bit about that optional sedation. We do have an option of nitrous oxide in all of our offices. This is laughing gas, which is often used in dentist's office. It's available pretty much at all of our locations. It is an extra cost, but especially if you're nervous or want to have the most pain-free experience, it is definitely recommended. A lot of patients have a good experience with this. Totally optional, you don't have to, but something that we offer our patients to have a little bit more comfort and peace of mind. About that procedure, 1 to 2 tiny incisions. Some urologists do 1, some do 2, and the doctor will get a little clamp on that tube and bring it up closer to that incision and separate it from the surrounding tissue. Either use suture or clips to separate and make a little separation with scissors in between the two and cauterize those edges. The incisions are closed with absorbable sutures, and you will have at least 1 or 2 stitches you'll see in the skin, and those will be gone on their own in a few weeks usually. And you'll be home within a few hours. Now, recovery is an important part about this. Really schedule the procedure so that you can take it easy the next few days afterwards. 2 to 3 days are fine. Ice pack, really want to ice it that day and the next day for sure. Something supportive, you want to wear that tight cotton briefs, compression shorts, athletic supporter, or jock strap. You don't want a lot of movement. You don't want things moving around. It'll cause more swelling that way. Treat mild pain with Tylenol, Advil, Motrin, Aleve. These are all fine after the procedure. Definitely avoid heavy lifting or exercise for 5 days to a week. Avoid intercourse for a week and follow instructions regarding temporary birth control. Basically, you're not sterile until we've checked it afterwards. So you want to make sure you're still using what you usually do. After 8 weeks, you should drop off a semen specimen and we look at it under the microscope to make sure that there's no sperm in there. Once we determine that, we'll give you a call and you can go off your regular contraception. Otherwise, follow-up appointments are not necessary as long as you drop off that specimen and we've deemed you sterile. Insurance. Many plans cover the cost of vasectomy. We recommend checking with your carrier and we'll definitely help with that around the time. Another thing about vasectomy, definitely want to think it through. We do consider it permanent. It can provide a peace of mind if you're finished having children. Permanent birth control, basically once you send that specimen off and we say that there's no sperm, there's a 1 in 2,000 chance of things growing back together. It is the most effective form of birth control, more so than tubal ligation or IUDs. It's a serious decision that should give thorough consideration. They can be reversed, but it doesn't guarantee success, and it would be a little bit more intensive procedure to have it reversed. So in summary, think it through, talk with your partner, and talk to a urologist. If there's any questions, I'd be happy to answer it. Otherwise, thank you very much for all your attention.